You might have seen some posts on your feed claiming that mpox, previously known as monkeypox, is the next pandemic. Not so fast. We spoke to infectious disease specialists, and the likelihood of this being a pandemic-level spread
is extremely unlikely.
This isn't COVID. This is not something that's going to rapidly rip through the world.
But it is a global public health emergency, which is considered by the WHO as a serious, sudden, or unusual condition. So what's the risk to you? The infectious disease doctors we spoke to told us that mpox in Canada has been mainly spread through sexual contact.
This wouldn't be something like walking past someone on the subway. This is a sustained direct personal contact is responsible for the vast majority of cases that have been seen so far.
Cases in Canada are climbing again this summer, but there have been way fewer infections here than in the 2022 outbreak. The doctors also say the virus has mainly affected men who have sex with men, especially those with multiple partners and sex workers. You're at the greatest risk of exposure if you're in contact with the bodily fluids or lesions of someone with mpox. Those lesions are the main sign of mpox, along with flu-like symptoms. The symptoms can be painful, but tend to last 2 to 3 weeks, and so far there's been no deaths reported in Canada. But now a different picture is emerging. Congo is experiencing its largest outbreak of mpox yet, with children making up many of the cases and deaths. The outbreak is linked to a form of the virus known as clade 1 that's thought to be more severe, and a new lineage known as clade 1b is spilling from Congo into other African countries. Scientists are racing to figure out how deadly and transmissible it might be compared to clade 2, the milder form that went global back in 2022. According to the Public Health Agency of Canada, clade 2 is what's circulating here, but clade 1 could spread even further. The good news is that there's a vaccine here, something that doctors are calling for Canada to share with African countries, where officials say they need 10 million doses. In Canada, the 2-dose vaccine isn't being given to the general public. Instead, it's going to high-risk groups like men who have sex with men. But you can check your local public health unit for more information. And the WHO announced this week that it's launched a 6-month plan to combat the outbreak and increase vaccine access to countries most affected.